We've got Southwest. Hi, Amanda.
Hi, guys.
And on line, we've got Pathwest.
This is the team tracking measles in WA.
So we have a newly confirmed case today. So just to sort of update people.
It's made up of doctors, nurses and specialists from around the state. For weeks they've been working around the clock trying to keep ahead of a fast-moving disease.
And can you recall the symptoms that they described?
Since mid-September, the health department says 5 people have brought measles in from overseas. 23 others have been infected in the metropolitan area, mostly by one man from New Zealand visiting Perth on holiday. In infectious diseases epidemiology, he is what's known as a super spreader, infecting people just about everywhere he went. New Zealand is currently suffering an epidemic with 1,800 people infected.
Any other highly suspected cases around the traps?
In WA, each new case is immediately isolated and their every movement retraced in forensic detail.
How they got to work, what train they caught, what bus they caught, where they drove their car, who they went out to in the evening, who's in their house, who's visited the house, the pizza delivery person.
Dozens of additional health staff have been mobilised, tracking down anyone who may have been exposed. For the vulnerable or unvaccinated, there's a brief window where medication can prevent the disease from taking hold.
But for one case of measles, we might have to ring 300 or 400 people.
And so with a number of cases well into the 20s at the moment, you can see that it's likely that we've contacted more than 1,000 people.
The health department is hopeful that all the samples coming through here will soon be testing negative for measles, but it warns there's a risk of similar outbreaks in Australia as long as the epidemic in New Zealand continues. Anyone born after 1966 who hasn't received 2 measles vaccinations is being urged to do so. James Carmody, ABC News.